Thank you for considering HealthSource Saginaw for your rehabilitation. This video tour is meant to give you an overview of our Medical Rehabilitation Center and the services we offer. The Medical Rehabilitation Center at HealthSource Saginaw offers state-of-the-art rehabilitation after stroke, brain injury, spinal cord injury, and amputation, fall, car accident, neurological disorder, surgery, or other temporarily incapacitating condition. Your needs may include physical therapy, occupational therapy, speech-language pathology, or all of the above. Let's start with what qualifies you for this level of care.
Insurance qualification for admission to acute medical rehabilitation includes participation in therapy at least 3 hours per day with occupational, physical, and when needed, speech-language pathology. A medical condition must require frequent physician visits and a discharge plan including return home or another community-based setting. Upon arrival at HealthSource Saginaw, you'll be escorted to your own private room on the medical rehabilitation unit. Each room has its own telephone, cable TV, Wi-Fi access, and a private bathroom and shower. Your nurse will be with you shortly after your arrival to review your medical information and do comprehensive medical assessment, including full skin assessment, review of your medications, review of hospital information, and your family support system. Finally, the nurse will discuss your schedule for physical therapy, occupational therapy, and speech-language pathology, review your meal planning, and familiarize you with your room. Your therapy may start the day you arrive at HealthSource. The faster we get you started with therapy, the faster we can get you on the road to recovery. After your nursing assessment, you will take a short walk down Main Street and you will arrive at one of our therapy gyms. Physical therapy will evaluate and diagnose strength, range of motion, balance, and pain caused by neurological and orthopedic disorders including stroke, head injury, spinal cord injury, vestibular disorders, Parkinson's, MS, cerebral palsy, back pain, headaches, joint replacement, joint pain including shoulders, hips, and knees, and sports injuries. Physical therapy services use specialized equipment and current evidence-based practices in treatment of our patients. Technologies like the Bioness L300 neurological aid provides electrical stimulation to help muscles move and regain function. Occupational therapy will evaluate and treat people who are experiencing difficulties in upper extremity range of motion and strength, hand function, gross and fine motor coordination, activity tolerance, sitting and standing balance during activity, basic self-care skills such as eating and dressing, instrumental activities of daily living like meal preparation and homemaking, and also safety in the home. HealthSource occupational therapy services use state-of-the-art equipment and have therapists that are certified to evaluate and treat with the specialized training devices. Both physical and occupational therapies may use our private treatment rooms for therapy and massage. Our fully functional and furnished therapy apartment allows therapists to work with individuals in a home-like setting from everyday household chores to bathing and personal care. We work with the patient and provide recommendations for adaptive equipment for their discharge home. Speech-language pathology will evaluate and diagnose communication, cognition, and swallowing deficits caused by a head injury, stroke, tumor, or other neurological disease. Speech-language pathology services use state-of-the-art equipment and current techniques in the following areas. Cognitive retraining emphasizing memory, attention processing, visual processing, and computer-simulated driving experience. Language therapy to address communication limitations caused by aphasia. Speech therapy to address articulation, voice, and fluency. swallowing therapy using deep pharyngeal neuromuscular stimulation, neuromuscular electrical stimulation, as well as diet modification and eating compensation strategies. Some of the most common disorders treated include aphasia, an impairment in language affecting comprehension or expression, oral or verbal apraxia of speech, an impairment of muscle use affecting voluntary control, initiation, and coordination of movement, dysarthria, an impairment in muscle strength, sensation, and speed, causing facial droop, drooling, slurred or distorted speech, dysphagia, which is difficulty with swallowing, a variety of components in voice, including pitch, volume, quality, intonation, or inflection, and cognition, including orientation, attention, perception, memory, reasoning, and problem solving. Our state-of-the-art aquatic therapy pool is a special feature used by both physical and occupational therapy for various medical conditions with the permission of a physician. For our pool, there are no steps you need to climb or lift needed to enter the pool. You can simply walk or be wheeled on the platform with a wheelchair. The platform then lowers to a depth the therapist wants to work with you. They may want to work with you at a shallow depth for resistance or deeper for buoyancy. The whole floor of the therapy pool is a treadmill. If walking or jogging is a part of the therapy, the treadmill can be used to speeds up to 8.5 miles per hour. If more resistance is needed, we can turn on jets for water flow and the feeling of walking up a current in a river. By placing an attachment on jets, we can also add massage therapy. Underwater cameras are used so the therapist can see what is going on below the surface. Average length of stay in our Medical Rehabilitation Center is about 12 days. Close to discharge, you will have a care conference where we will plan your discharge home, including setup of home care, adaptive equipment, and anything else that may be required for a safe discharge home.
I recommend HealthSource for your rehabilitation or any accident you've had or stroke you've had or knee replacement. It's a very nice place.
I recommend HealthSource because they do a great job here with physical therapy in general. I was walking with a walker when I left here. When I came in, I couldn't walk and hold my head up.
HealthSource is family.
I highly recommend therapy here. It gave me my life back.
The people here gave me the ability to come back and do my job again.
Thank you for taking the time to join us on this virtual tour of HealthSource Saginaw's Medical Rehabilitation Center. Please feel free to browse our website for additional information or call us at 989-790-7815 if you have additional questions.